Welcome back to the Racing Mind video series, where we journey deeper into the human mind than anyone has ever gone before. In this video series, we untangle the ancient mystery of mental illness and teach you what you need to know before your racing mind gets the best of you. This groundbreaking series provides answers to some of the deepest mysteries of the human mind and reveals, for the first time in history, the precise cause of mental and emotional illness and the psychophysiological basis of a wide range of psychiatric disorders and associated medical conditions. These educational videos, which present concepts that are so new that they are just beginning to make their way through the medical field, are based on thousands of hours of direct patient analysis and clinical observation in conjunction with the latest research on psychiatric disorders from around the world. In this segment of the series, we will discuss neuronal hyperexcitability in relation to the hormonally-related disorders premenstrual dysphoric disorder, postpartum depression, and perimenopausal depression. All of these hormonally related disorders are characterized by similar symptoms, which may include anxiety, depression, irritability, loss of energy, difficulty concentrating, appetite changes, and sleep changes. Though only a small percentage of women experience enough of these symptoms to meet diagnostic criteria for one of the hormonally related disorders, up to 80% of women report having at least some of the symptoms in the days leading up to the end of their menstrual cycle. That tells us that the hormonal changes that women experience on a monthly basis are somehow tied to the aforementioned psychiatric symptoms. As we have been discussing in this video series, psychiatric symptoms are driven by a hyperactivity of symptom-related circuits in the brain. Close to the end of the menstrual cycle, there is a rapid fall in the hormone progesterone. The same occurs at the end of pregnancy and during menopause, thus linking all three disorders to a fall in progesterone levels. Progesterone is an anticonvulsant, hence, the brain becomes more excitable as the level of progesterone falls. This would explain why nearly all women experience mild premenstrual psychiatric symptoms, although some women, presumably those with neuronal hyperexcitability, tend to experience a greater number and severity of symptoms than others. Lending further support to the idea that neuronal hyperexcitability is at the root of premenstrual dysphoric disorder, postpartum depression, and perimenopausal depression is the observation that the percentage of women who experience moderate to severe hormonally related psychiatric symptoms is roughly the same as the percentage of women who we estimate to have inherited the genes for neuronal hyperexcitability. Neuronal hyperexcitability may also explain the peculiar second wave of schizophrenia that is unique to women between the ages of 35 and 55. Unlike in men, a woman's progesterone level begins to fall rapidly around the age of 35. This is accompanied by an increase in the ratio of estrogen to progesterone between the ages of 35 and 55. Since estrogen has proconvulsant activity and progesterone has anticonvulsant activity, the excitability of a woman's neurons would rapidly increase between the ages of 35 and 55, which is exactly when the second wave of schizophrenia occurs in women. Consistent with the theory, women have also been observed to have a second wave of new onset bipolar disorder and other psychiatric disorders during these years. As with other psychiatric disorders, stress reduction, establishment of an early sleep schedule, regular exercise, enjoying a relaxing hobby, avoiding caffeine and other psychostimulants, and minimizing refined sugar are the best natural ways to prevent symptoms from recurring. Then again, because these interventions do not correct the gene abnormality that is at the root of these disorders, anticonvulsants and other brain calming medications may be needed to offset the neuronal disinhibition caused by the loss of progesterone's anticonvulsant effects. Progesterone replacement therapy may also be helpful, but may not be as safe or as effective as anticonvulsant therapy because it is not as specifically targeted at the fundamental problem of neuronal hyperexcitability. Control your brain, control your life. We hope that you are benefiting from this video series. Portions of the video and others in this series were taken from the books The Racing Mind and Am I Depressed or Am I Bipolar? Those interested in developing a deeper understanding of the topic can also refer to the scientific publication, The Multi-Circuit Neuronal Hyperexcitability Hypothesis of Psychiatric Disorders. Please note that these materials in this video series are for educational purposes only and are not intended to guide treatment without formal evaluation. This video series is sponsored by the Binder Foundation, a charitable organization that is dedicated to the enhancement of human life through research and education on disorders of the mind, body, and spirit. If you have found this video to be a benefit to you, please share it with your family and friends. And please don't forget, your feedback is important to us.